Hello everyone. Today I would like to share something very important. A lot of people, a lot of patients who come visit the dentist, they are a little hesitant in sharing their medical history. So I thought of making this quick video on the importance of sharing the medical history with your dentist. Sharing the medical history with your dentist is extremely important for your own good, for your own benefit. Why is that so? The reasons. The first reason is that there are certain medical conditions that the dentist needs to take extra precautions while carrying out the dental treatment. So if he or she is unaware of any kind of medical ailments that you are suffering from, he will be unable to take those precautions. Okay, so any kind of emergencies can be avoided if you share your history with them. The second reason being there are certain medications that need to be stopped prior to certain dental treatments. Okay, so for example, blood thinning agents, blood thinning medicines, which has been very commonly prescribed during this pandemic. So these need to be stopped prior to removing the tooth, of course, but this is with the consent of the doctor who's treating you. So if you do not tell your dentist that you are on blood thinners, okay, the dentist will straight away go ahead with removing your tooth, and this could lead to some serious conditions, serious problems like continuous bleeding, okay, which gets little difficult to control. So if you have shared this history prior to the dental treatment, the dentist can take all those precautions. He can ask you to stop those medications prior to the dental treatment. The third reason being there are certain medical conditions for which the dentist needs to prescribe antibiotics just as precautionary measures. So if he's unaware of your medical history, he may not prescribe those antibiotics, and you may be at a risk of developing some certain infections. So it is necessary that you tell and share your medical history to the dentist. The next reason being, I have been telling this always, that oral health and general health is interrelated. So there are certain medical conditions or certain medications that have effect on your oral health. Okay, so if you do not tell your medical history, the dentist may not go into the right diagnosis. So if he is aware of your medical history, if he is aware that you are suffering from certain condition, and he has the knowledge that these conditions can affect the oral health, so a proper diagnosis can be achieved with the medical history. For example, now there are a very simple example I'll give you, certain medications used for epilepsy, that's seizures or fits. These medications affect the oral health. These medications affect the gums. There could be gum swelling because of these medications. So if you do not tell your dentist that you have this issue, you are suffering from epilepsy, this gum swelling can go into a wrong diagnosis, right? If the dentist knows about it, then he would come to a good diagnosis. So it's very important to help your dentist to come to a proper diagnosis. So any kind of, one more thing is that if you're allergic to any kind of medications, it is very important that you tell it to your dentist so that he avoids those medications while prescribing medicines to you, So he will not prescribe those medicines which you are allergic to. So if you are allergic to any kind of medicines, you should be telling it to your dentist. If you're facing any kind of medical problems, maybe diabetes, hypertension, that's blood pressure, any heart disease, epilepsy, asthma, thyroid, cancer treatments, digestive problems, anything, you have to tell it to your dentist. If you're taking any kind of medication, maybe it could be allopathic, it could be Ayurvedic, it could be homeopathic, it could be any other kind of treatment that you are taking, any supplements that you're taking, please share it with your dentist. If you have had any kind of hospitalizations, any kind of surgeries, it is very important that you share it with your dentist. It's all for your benefit, it's all for your good treatment. So it's very important that you share it with your dentist. That's the only reason for me making this video, is that a lot of people are very hesitant in sharing. I have seen so many patients at DSD, that is Dr. Supriya's dental clinic. We follow a protocol. When the patient first enters the clinic, he is asked to fill up a form which has all these medical conditions enlisted, and he is supposed to write down any kind of medications that he is taking, any kind of medical conditions that he is suffering from. The next step, just before the dental treatment, just before the consultation, I again ask for the medical history. This is the second step. The third step is during while I'm prescribing the medicines in my consultation room, again I ask for the medical history. So it's like 3 times I ask for the medical history, and I have observed that when the patient fills up the form, he does not fill up any of these medical conditions. Second, when I am asking for, before starting the examination, when I ask them, that time a medical history is revealed. Oh doctor, I am suffering from diabetes. Okay. Then the third step, when I am prescribing the medicines and I ask them again for the medical history, then again they would come up with one more medical history. Oh, I'm suffering from depression, or I'm allergic to this medicine. So my advice is that please don't stop sharing the medical history with your dentist. It's very important. It's for your own good. So be upfront and tell whatever you are suffering from, whatever medications you are on, so that he or she can give you good treatment and can take all the precautions that are necessary. Yes, that's it, and thank you.